The AM show right here on Joy News, your home of independent, fearless, and credible journalism. And today we are hosting another doctor from Endpoint Homeopathic Clinic. The last time we hosted Dr. Boaten, and he enlightened us about what really is homeopathy. Today we want to pivot into stroke. And my guest is Dr. Boaten. He's also a homeopathic practitioner at Endpoint Homeopathic Clinic. He's going to help us really understand what it means when we say someone has got a stroke, get into some misconceptions about stroke, especially as it relates with young people, and the way forward, how we can keep safe. Dr. Boaten, it's a pleasure to have you join the conversation on this important matter.
Thank you.
And how are you doing at Endpoint Homeopathic Clinic, including Dr. Boaten?
Yeah, we're doing very well. I'm sure he's watching you right now.
Yeah, okay.
Yeah.
Right, let's just get into the conversation straight away. We've heard someone got stroke, somebody died and it was stroke. When we talk about stroke, what really does it mean when a person has suffered a stroke?
Thank you very much. With this topic, I think we should be able to listen to it with rapid attention, because throughout my experience in this field, I've seen that a lot of people are now disabled because of stroke attack. A lot of people are dying because of stroke. But what I would say is that stroke occurs when blood is unable to get into the brain. When there's a disruption that makes it difficult for enough blood to enter into somebody's brain. What happens is that human beings as we are, every part of our body needs blood, enough blood. And every part of the body also needs oxygen. Okay. And with blood, the water that you take, the food that you eat, the nutrient, the nutritional part of every food that you eat enters into the blood. Okay. So at a point in time when you're not getting enough blood into your brain, what is going to happen is that you are starving the brain cells of these food nutrients. And then you are also starving these brain cells out of from this oxygen. So when there's a disruption, whether the arteries is not permitting enough blood into the brain, or when there's a break, or when there's when part of any of the arteries burst into your brain, blood oozes into the brain, and that is also another form of stroke. Okay. So in this case, there are two forms of stroke. There's one what we call ischemic attack, or ischemic stroke. That happens when, you are getting enough blood, you are getting blood, but the blood that you are getting into the brain is not enough.
Or does not have enough oxygen.
Do not have enough oxygen.
Okay.
And because of that, maybe some people may have maybe blood clots in the arteries. Okay. And once there's blood clots in the arteries, blood will struggle to pass through the arteries into the brain. And in so doing, that can also result in stroke. And then there's another type of stroke, what we call hemorrhagic type of stroke. In that case, what happens is that the arteries that supplies blood into the brain can end up rupturing, or it can, what we call rupture, or there can be a break in it. Okay. That will cause blood to be oozing into your brain. When that also happens, it's also another means for one to be able to get stroke.
From my understanding of what an artery is, they are small tubes that carry blood and other nutrients or whatever to the important parts of our body. What could possibly cause an artery to erupt, or what could cause that kind of blockage in the mind or any part of the body that would impede the great circulation of blood in the body? Yes,
usually cholesterol can even result in that. When there's too much cholesterol, that's the bad cholesterol. When you have so much of that, that can stampede, or that can cause the blockage in your arteries. Or sometimes too, when there's too much pressure. When there's too much pressure, you see, one of the main causes of stroke is pressure, hypertension. One of the main causes of it, I would say, with the number of people that comes to Endpoint Homeopathic Clinic, I would say that about 80 or 70% out of that get stroke because of uncontrolled pressure. Whenever one is having pressure, we should understand that means the amount of pressure. That's the meaning of pressure, the hypertension.
Hypertension, yeah. So high blood pressure.
High blood pressure.
Right.
That's the pressure pushing your blood through your vessels. If it's so much, that can also cause the artery to even break, or there could be a rupture of the.
So when blood is pushed at an unusual, abnormal speed.
Yes.
That's what we call high blood pressure.
Yes.
And that can also cause
yes, that can cause. And indeed, from the people that comes, I've realized that about 70-80% get this problem. Most of them, by the time you finish with their medical history, you realize that most of them, the stroke was caused by the hypertension.
Right.
Because it's just like you having a gutter. And then when water is supposed to flow to your gutter, to your house. And then when you see that when there's flood and the water, the pressure in that water that flows through your gutter is so much, what happens is that sometimes it ends up breaking the gutter, the walls of the gutter. And then when it breaks that way, you see that the water will be channeled to any part. It will not be channeled through the gutter again. Then it may end up ending in people's homes. In the same way, when the pressure that is pushing your blood through your vessels is so much high, the pressure in it is so much high, sometimes you may end up even breaking the artery, and that can result in stroke. Apart from that, a medical condition called diabetes is also causing so much, especially those with high sugar level. When the sugar level is so much high, because the sugar level, meaning that the glucose level is so much high, it will end up affecting the artery. It starts weakening the walls of the arteries, and that can also result in what we call a stroke. Apart from that, what is actually happening these days, you realize that the youth are actually getting stroke.
Yes.
And it's because of the lifestyle. I'm saying this because, people, when you talk about other risk factors such as alcoholism and so on and so forth, there was a patient that asked me, some years ago, 50 years ago, 40 years ago, people used to drink alcohol and all that. What has changed? And that time, it was difficult for you to get somebody getting stroke. Before you get somebody getting stroke, the person might have been in the 70s, 80s, and so on and so forth. And today, 30s, 40s, 50s. What is happening? We are not taking alcohol, and are we not taking alcohol? The alcohol content that we are taking now is more than what they were taking. Now, just try a challenge. If somebody comes to your home and you offer the person a bottle of water and then a bottle of alcohol, you realize that as the person is taking the water, a bottle of water, they are sipping the water. People actually sip water.
So we are not drinking enough water.
We are not drinking enough water.
Okay.
So now it is so easy for people to come to you once you pick a blood sample, you realize you've not even conducted any test on them. You realize that there is something wrong with the blood. Because people are consuming too much alcohol. People are consuming too much recreational medications. The weed and everything. Now you can ask so many of these ladies around or so many of these gentlemen around that, do they take weed? They will tell you, no, I don't take it. But they are taking the weed in so many forms. In a toffee form, in so many, now they've even gotten some name for it. Edibles, they will tell you edibles. Oh, if I take edibles, they're right. Yes.
Yeah.
Now people are blowing too much balloons. There are people blowing to, the balloon that I'm talking about. It's not the normal balloon
the nitric gas.
Yeah, the nitric gas.
Yeah.
Those gas are not good for the system.
Right.
The gas that we need for the system to work well is the oxygen.
Okay. So
any other gas you introduce into the system, if it's too much, can result in all this. So now I would say that lifestyle is actually causing about 60 or 70% of what
causing stroke. So aside these lifestyle or behavioral causes of stroke or behavioral causes of hypertension, high cholesterol, which also leads to stroke, are there cases where it's just a purely medical situation? Someone has impeccable health record but ends up getting stroke.
Yeah, there are times like that.
What accounts for such rare situations?
Yes, there are times that somebody could be having even a cardiovascular condition, heart-related conditions. The heart is unable to pump enough blood, and for that matter, the person, and this might have happened for a very long time. the person could end up. And there are times that people who are aged, you know, people who are in their 80s, 90s are getting stroke, because naturally, once you are aging, the arteries weakens. Naturally, human beings, that's how it is. Once you are, and that is how, you know, it is expected that when somebody is 70, 80, 90, and the person ends up getting stroke, it's not so much of a problem, because at that age, you can, it's not surprising. But we are talking about a situation where we find people like myself and yourself getting stroke. You understand? You realize that most of them is because of their lifestyle. But the aged getting it, obviously, once they are aging, the arteries is also weakening. And for that matter, it can end up breaking. Once there's a pressure, once there's even the pressure going too low can also result in that. Once there's a sugar, you know, which is not controlled, that can also result in it. So medical conditions can result in it, and then lifestyle also can also result in stroke.
What you've done so far is debunked some myths associated with stroke. For instance, the issue about only adults that suffer strokes, because we see young people also getting it, and you say it's lifestyle choices.
Correct.
It's behavioral.
Correct.
It's the things we consume. You also talked about the occurrence of stroke only in people who don't take care of their bodies. But we know that there are rare conditions where medical issues cause stroke.
Correct.
So then let's move to, is it true that stroke and heart attack are one and the same issues? Or are there any differences between them? And then we can talk about how to deal with this situation.
Yes, when you have a heart-related condition and you don't, you know, you don't visit your practitioner, if you leave it for a very long time, what is going to happen is that the heart is the one that has to pump blood to all parts of the body. So if you have a heart condition and care is not taken, if medications are not taken, it cannot only result in stroke. It can result in so many things.
So a heart attack will rather result in a stroke?
That's right, yes.
Okay.
Because you see, when the heart is attacked, what is going to happen is that the heart is unable to do its primary function, which is pumping blood, because that's the work of the heart. The heart is just like it's a central part of the circulatory system. Its work is to be able to pump blood to all the parts of the body. Now the heart is attacked. When the heart is when somebody's heart gets attacked, the muscles making even up the heart can end up even damaging.
So a heart attack is simply failure of the heart to pump blood to all parts of the body.
And once it's not pumping blood to the brain, what happens is that you can get stroke. If it doesn't pump blood to the kidneys, you can have kidney failure. So, I mean, the heart attack alone can cause so many complications.
So a heart attack and a stroke are not the same things.
They're not the same thing.
A heart attack
can result
into a stroke.
Excellent.
Great. Thank you for debunking these three myths. Now let's go on to how do we deal with stroke? How do you even identify that someone is having a stroke? Because we know that when you catch it early, you go to the hospital early, you just might be able to save that life.
That's right.
So how can you tell that someone is having a stroke?
Yes, the first thing that will show in somebody getting a stroke is that usually paralysis can take place. Usually people with stroke, it can affect either the right-hand side or the left-hand side of the body. So there could be paralysis. Somebody, you know, if you are home and you realize that you suspect somebody has gotten stroke, you can tell the person to raise up the hand. Mommy, can you raise your right hand? Let your mom try to raise the right. If the stroke has affected the right, you will see that as she's raising it, it becomes so heavy. The arm is so heavy, the arm is so numbed that your own arm, you find it difficult. It feels like you are carrying about 50 kilograms of, let's say, cement or whatever. So you realize that the person will not be able to raise the arm freely. So you have to support it with another arm. That will tell you that if it's the left-hand side too, it's the same thing. You cannot. So you see that all the arm, the person will try, they will make the attempt of raising the arms, but one part of the arm could be raised, the other one could not be raised. That will tell you that the person.
So paralysis.
Paralysis, it can. And then sometimes the speech. You know how I'm speaking. I know how sweet your voice is. And all of a sudden, may God forbid, if you start speaking and then your voice is not coming. Partially, you are losing your voice. Or some people can even lose the voice completely.
Just the voice or stuttering?
The speech,
the flow,
yes. So the flow may not be there. Somebody may even lose the voice at all. Somebody may also be able to talk, but may lack the difficulty. The person will struggle to speak.
Okay.
Or sometimes some people will start stammering. You know that, oh, this person speaks very well. And then sometimes the person is not able to organize the thoughts. Difficulty in organizing thoughts. You understand? All these things, could, or sometimes the voice could even go completely.
All right.
So that's another sign of somebody who has gotten a stroke. And then there are sometimes the movement. Sometimes you can even ask the person to also move, or sometimes you can even ask the person to smile. Usually, it can end up affecting part of the face.
Okay.
So there can be facial paralysis as well, where part of the face droop. You as if this part, you realize that part.
So what do you do when you've seen all these? When you've seen one sign, what do you do?
Immediate.
If like the example
That's
you
right.
gave, if we are together and then I spot one of these symptoms you're talking about, what do I do?
You immediately have to go to the
hospital.
Yes, if now that we have a lot of ambulances and all that, possibly you call an ambulance service, because the more you keep the person at home, the brain cells could end up getting damaged.
Okay.
So the more, because it could be the pressure that resulted in the stroke.
Okay.
And now what is happening is that the pressure is still high. The pressure that caused stroke had not gone down.
Okay.
So what is going to happen is that pressure could be destroying a lot of things. Maybe it ended up just damaging one artery. Now the person is still at home, nothing is done to it. Yeah. It will end up affecting others as well.
So the more you delay in seeking medical attention,
it causes a lot.
It causes fatal results.
Yes.
We know that these are some of the things that you treat at Endpoint Homeopathic Clinic. When we talk about stroke, how do you use homeopathy to not just treat the occurrence as and when, but ensure that it doesn't occur again?
Thank you very much. What happens is that when somebody has stroke, with Endpoint, the moment the person comes, we check the vitals. Pressure first thing. You need to find out the pressure, you check the sugar level. You do the normal checks as orthodox do. And then you have to do scanning. We have a scanning machine that can scan the nervous system. Okay. That is the brain, the spinal cord, the nerves. Because you see, one thing that happens is that once people get stroke, usually the nerves also get affected. Yeah. Because once paralysis takes place, that is where, and you realize that most people that come to Endpoint, if you ask them, because if the signs that I was giving you, it happens when the person has already gotten the stroke. When you have already gotten the stroke, that is where you have problem with your speech, you have problem with your movement, the balancing and all that. But there are some symptoms that start way earlier before the stroke actually strikes you down. Which you can only tell, or you can the patient, using your machine. Yeah, the patient can also see that. Okay. Because if it's a pressure that is bringing it, you realize that sometimes you get palpitation of the heart. Right. The heart could be beating for you to, because the heart always beats, but you don't feel it. As I'm usual rate. Yes, you. Okay. There could be dizziness, there could be bodily pain, there could be sudden fright, there could be movement in the body, there could be insomnia, sleeplessness, and sometimes the nerves will start also damaging. Once the nerves start damaging, burning sensation, movement in the body, tingling sensation, nervous imbalances and all that. So when somebody comes to Endpoint Homeopathic Clinic, we do a scanning for the whole nervous system to know where the stroke actually, what type of stroke are you having, the effect of the stroke and everything. Then we can give medication, and then physiotherapy can also, the person is also asked to go through physiotherapy at the clinic. In 1 minute, please in 30 seconds, please, tell us about the free screening you're doing and then how to contact you. You are here, so I'd like you to do it. Thank you very much. Endpoint is undertaking free scanning on prostate gland, prostate, and then free scanning on fertility, female fertility. That is to check your reproductive organs. The scanning is free, but the lab is 300 Ghana cedis. You can contact me on 0244 or the clinic on 0244 867068. 0244 867068.
Thank you so much, Dr. Edu Boaten, who's a homeopathic practitioner at Endpoints Homeopathic Clinic. And you know, Endpoints Homeopathic Clinic are the sponsors of our news review segment. So hopefully you get another opportunity to get into some of these health issues. Thank you so much. It's been a pleasure.
All right.
Thank you for watching.